Hello, everyone, and welcome to a special episode brought to you by Delarc Pharmaceuticals. I'm your host, Nagbhushan, and today we are clearing up a confusion where misinformation does the real harm. Prostate cancer, myths versus facts. We're joined by an expert today, Dr. Raghunath S K, a leading uro-oncologist and director and head of Uro-Oncology and Robotic Surgery at HCG Cancer Center, Bengaluru. Doctor, thank you so much for being here today.
Thank you.
Before we bust the myths, it's very important for us to understand what does prostate gland means, where it is, what are the functions of it, and what is the situation of prostate cancer in India. So can you throw some light on it?
Yeah, thank you for asking this question. Prostate gland, it is situated below the urinary bladder. Urine passes through the prostate and it comes out. It's about a walnut size. It has many functions. It provides nutrition to the sperms, and as the urine comes out through the prostate gland, enlargement is very common after the age of 40 years or 50 years for almost all men. That is called benign enlargement of the prostate. Whereas we are going to discuss about prostate cancer, which is not benign enlargement, which is a cancerous, enlargement of the prostate. Symptoms are almost common for benign enlargement and prostate cancer. Prostate cancer is on the rise. That's why we should discuss about this prostate cancer.
Thank you so much. Thanks for setting the right context in order to take this conversation ahead. I have a few simple questions with respect to prostate cancer. I'll probably read out those for you. How big of a role do genetics and family history play in prostate cancer?
So we must understand what is genetic and what is familial. Genetic, most of the cancers are genetic, meaning to say, when you do genetic evaluation for most of the cancers, at least one or the other genes or abnormality of the genes would be present. Familial is different. Familial means the cancers are running in the family. Father is having, and the children can get that. Okay, that is familial. But most of the prostate cancers, or some of the prostate cancers, are familial also, and most are genetic.
Okay. Now, in such cases, when it is not depending on the family history, so do lifestyles matter? Because nowadays we're all on the fast lifestyle, diet, exercise, healthy living. Does it affect the prostate cancer?
I would add few more lines for genetic and familial. If father is suffering from prostate cancer, chance of son developing the same prostate cancer is slightly high. Okay, that is both familial as well as genetic. For the same person's daughter, chance of developing breast cancer is also relatively high. Okay, so coming to the risk factors or lifestyle modifications, there is no specific cause for prostate cancer. As I told you, it's genetic, abnormalities will be there, but lifestyle modifications can reduce the incidence of prostate cancer, particularly when it comes to the diet. Excessive consumption of red meat is one of the risk factors for this. If you do exercise regularly, your chance of developing prostate cancer is relatively less. When it comes to other lifestyle habits like consumption of alcohol and use of tobacco, generally increase the risk of developing any cancers for that matter. And with respect to prostate cancer, definitely incidence would be more. And dietary factors, diet rich in fruits and vegetables, and lycopenes. Lycopenes are present in the tomatoes, cooked tomatoes, not raw tomatoes. And even turmeric to some extent uh, plays a role to prevent development of prostate cancer.
Okay, so basically you mean a healthy lifestyle and
Lifestyle, exercise, and food rich in lycopenes, fruits and vegetables, and doing exercise probably to some extent it can prevent. Yes, yes.
so before even the cancer happens. So first part is, detecting it, right? So for men, I mean, it does definitely happen only for men. So at what age they should consider, getting a screening done?
Most of the Indian men think that I don't have any symptom, why should I go to a doctor? Fortunately or unfortunately, stage 1 and stage 2 prostate cancers, they may not produce any symptoms. But if you detect in stage 1 or stage 2, by just doing a blood test, simple blood test, when you don't have any symptoms, it is possible to cure almost 100%. That's very important. Unlike other cancers, if you detect prostate cancer in stage 1 and stage 2, it is possible to cure. That detection of stage 1 and stage 2 cancers happens only by doing a PSA test and examining the prostate.
Okay.
Okay. So PSA test and you go to your doctor. When you don't have symptoms, go to your doctor. They examine the prostate, they do the PSA. By these two, we can at least predict what are the chances of having prostate cancer. If suspicion is there, we do battery of other tests like MRI, prostate biopsy, and if it is positive, then we may do even PET scan to understand the stage of the disease.
So while we were discussing, you told a word which is PSA. So can you elaborate on a little bit on that?
PSA is a simple blood test. It's called prostate specific antigen. It's available in most of the labs, which costs anywhere between 500 to maybe 1,200 rupees. It is recommended for all men after the age of 50 years, yearly once do your PSA. By doing PSA regularly, your chance of detecting prostate cancer early is very high, and chance of cure is almost close to 100% if you detect it.
Wonderful. So it's very important that people do at that age consider, getting the test done. Wonderful. So we are like in an Indian context, we are seeing the cases rise. And why is that happening? Is it even true in the first place? And why is that happening?
Yes, the incidence of prostate cancer is rising. Every decade it is increasing. Compared to Americans and Caucasians, the incidence is relatively less. But unfortunately, we do not have exact incidence because whatever the data we have, it's all is not population-based data. It is hospital-based data. Okay, hospital data system, they acquire this data, which is not true. Okay, what is the population-based data? That is more accurate. Unfortunately, we do not have that. But I would say approximately 15 to 20 men out of 1 lakh men suffer from this disease. This is probably tip of an iceberg. If you do proper analytics, incidence will be even more.
So still, India has not got to that extent where
Yes.
people are very well aware of, this thing and they're not getting it screened.
Yes.
Great, thank you. So you mentioned a very important thing about the family history, right? So let's say a father has it, and the son, of course, will be highly prone to having a prostate cancer. So in such situations, if they're aware that their father had it, what is the right time for the son to come and get the screening
Oh, this
done?
is very important. If family history is not there, every man should go for PSA testing yearly once from the age of 50 years. If family history is there, not just family history of prostate cancer, even family history of breast cancer, ovarian cancer, colonic cancer, they should start their screening from the age of 40 years and yearly once because their chance of developing prostate cancer at an early age is relatively more. And when it comes to the you know daughters screening, they should start screening for the breast cancers by doing a mammogram test maybe from the age of 30 years because we do see a lot of breast cancers in very young women.
Okay, makes sense. I think if you have a family history, it is always advised that you get it as early as possible. Never be late to these kind of things, so you'll not
But
suffer.
generally 40 years is the cutoff if you have family history. Some guidelines do recommend even from the age of 35 years.
Okay. Never, I mean, don't be sorry later. Better to get it done as soon as possible. Makes a lot of sense. Thank you so much. Uh, with that foundation that we learned about prostate gland and prostate cancer, let's move ahead to myth busting. But I think before we even do the myth busting, it's very important to understand that why should we bust all these myths, right? Why can't we just head on with the facts and information to the audience and give them the outright information? Why are we talking about myths in the first place?
Because cancer is a stigma even now amongst the educated. Giving the right information is very important that can save their lives. So it's very important to tell them about the facts and you know myths we have to discuss so that they understand they get the right information.
Okay. Do you feel that access to the right information itself is a, scarcity now
Yes.
than the treatment?
Yes.
Okay, so let's take this opportunity today and help our audience get the right information, get the factually correct information, and bust all those myths today. So let's do this.
Yes.
Wonderful. So let's dive into myth number one, which is I'll just read out for you. So let's dive into the myth number one, which is very commonly known as prostate cancer is an old man's disease. Is that true?
It is not true because we have seen prostate cancers in as early as 40s. So these are relatively rare, but generally prostate cancer is seen after the age of 60, 65 years. But we do see young men coming with very aggressive tumors.
Okay, so it's always advised. It's no more old age man's disease. It's even very well can be
Yes, that's why we recommend when family history is there, we recommend screening from the age of 40 years.
Very true. Makes a lot of sense. So let's get to the second myth. I think this is not just for prostate cancer, but any cancer and anything in general in India is that if I don't have the symptoms, I don't need to be, screened or examined. So what do you want to say about it?
As I told you, prostate cancer in stage 1 and stage 2, they will not have any symptoms. So when you don't have any symptoms and if you detect this disease in stage 1 and stage 2, it is possible to cure. So you should not miss that opportunity. If you wait for the symptoms, generally it will be in stage 3 or stage 4. You're going to miss everything. In stage 3 and stage 4, particularly stage 4, you cannot cure it. You can only control. But control is, again, it is very much possible with respect to prostate cancer because prostate cancers are relatively slow growing. When you detect prostate cancer in third stage, cure may be possible, at least maybe 50-60% possible, but they end up taking multiple treatments like hormone therapy, surgery, plus radiotherapy, all those things. So the cost burden will be so much, and the side effects of this treatment will be more. So to avoid that one, better to detect this cancer in a very early stage when you don't have symptoms.
But I think I would also want to highlight a point that they will have no clue about it, right? So let's say 50 years, or they are not aware because, like you rightly said, most of Indian men does not even know that they have it, or like if say the previous generation is 60 plus and then they got to know. The younger generation would not even have an idea whether my parent had it or not. So for them, the awareness would not be there. So even if they, let's say they're supposed to start at 40, but so is there a way that,
Very important point because we are uro-oncologists. We started this uro-oncology department for the first time in South India almost 18 years ago. So this is our social responsibility to educate the people, to create awareness about this disease because cure is possible.
just a small test can help you get past that big stage, and then,
Yes.
you can avoid a big risk.
Yes.
Makes a lot of sense. Thank you so much. So let's dive into a little technical details here. So we talked about PSA. So let's say I get a test done and I have a high PSA. Does that mean I have cancer?
No. High PSA is not always cancer because PSA is prostate specific antigen. It is not prostate cancer specific antigen.
Okay.
So PSA can be elevated without having cancer in certain situations. Like for example, if you have urinary tract infection or infection in the prostate, soon after any intervention on the urinary system, elevation of PSA is expected. So it is not just one PSA. If PSA is elevated, you go to your doctor will differentiate whether this is because of cancer or because of something else.
Okay, it's we should definitely consider a doctor's observation on the report than doing a self-diagnosis.
Doctor should interpret, you should not interpret.
Wonderful. So this is not something that you self-medicate.
We generally do not do PSA when they have infection in the urinary system or when they have difficulty in passing urine with fever, burning sensation. We don't advocate PSA.
Okay. So generally, you don't recommend the audience or whoever is listening to just go and take a PSA because they feel, oh, I might want to get tested.
If you're all right, you can get a PSA screening as a part of mast cell checkup. If you have any urinary symptoms, consult a doctor. They will prescribe.
It's not recommended to take during that time. Wonderful. Got it. So we learned about PSA and awareness at the early stage. Now, what are the treatment options available for a common audience?
Yeah. So detecting is very important. As I told you, the symptoms of prostate cancer or even benign enlargement of the prostate are almost same. They'll have difficulty in passing urine. Night increased frequency can be there. Even after passing urine, they may feel like, I've not emptied my bladder. So these symptoms are very important to decide about the treatment. The other important parameters are stage of the disease, age of the person. So we put all these things and we risk stratify. So very low risk, intermediate risk, and high risk. It also depends on the stage of the disease. If the person's life expectancy is, say, very short, we may not give any treatment. Or if the disease is very low risk, meaning to say this disease may not give him any problem during his lifetime, we just observe them. It is called active surveillance. We monitor PSA at regular intervals, okay, without giving any treatment. If the disease is aggressive disease, if it is present within the prostate in a younger individual, generally we go for either surgery or radiotherapy. Surgery means it's always robotic surgery nowadays because robotic surgery has become standard of care, where we remove the prostate, we remove the seminal vesicles and lymph nodes, so that by removing all these things, if it is present within the prostate, it has not spread outside, it amounts to cure. So it's a curative option. Alternative to that surgery is hormone therapy and radiotherapy is there. In case if it is in stage 3, probably they may require multimodal therapy. As I told you, hormone therapy plus surgery plus or minus radiotherapy may be given. If it is stage 4, means it has gone to other parts of the body like bones, lungs, liver. In such situation, we may not be able to cure, but we can certainly control by giving hormone therapy. But generally, for stage 4 prostate cancer, after giving hormone therapy, again the disease comes back maybe within 1.5 or 2 years. So they may require chemotherapy. So many other treatment options are there. Lutetium therapy is there. So many other options are there. So these are the treatment options available. So your doctor will decide what is the right treatment for the right patient for the right stage.
Okay, makes a lot of sense. So let's say, can you give me a few examples of cases that you've handled where in various stages, how you analyze the risk or, I mean, because see, we are talking a lot of buzzwords and jargons here. We definitely want to make something simpler for the audience who are watching. Is that some cases that you would wish to discuss?
Yes. Since we started our department for the first time and we have a big team of uro-oncologists, we treat only these uro-oncological cancers. Our volumes are also very high. In fact, we do one of the highest number of prostate cancer surgeries by using robotic system, probably in Karnataka or in South India. Because of our experience and because of our, we are at HCG Cancer Hospital, we get more patients. Because of our experience, even the results are also better. We have done more than 1,200 robotic radical prostatectomy surgeries. Before the availability of robotic system, we have done more than 500 open surgeries. So with this vast experience, our outcomes are also better. Our cure rates are better and complications are less, outcomes are better. With this robotic surgery, I must tell you, we just admit 1 day before and 2 days after the surgery, though it's a major surgery, we discharge them. Almost from last 3 years, we have not given any blood transfusions. And at least 40% of our patients will have continence the moment we remove the catheter, which is very good. And even we can preserve their quality of life or even sexual function utilizing robotic system.
Wonderful. While you enlightened me on the process of how easy and how flexible it has become now with the help of technology and the latest advancements and plus your experience in dealing with the patients, it is also important. I'll come to the fourth myth, which is if I have prostate cancer, I will lose my control on my bladder and I will lose my sex life. Is that true or it's a myth?
It is partly true. It all depends on whether a person having sexual activity is he active sexually before surgery. If he is not active, then the question does not arise. If young patients, if they're sexually active, we can preserve their neurovascular bundle of nerves which are required for erection because these nerves run behind the prostate. The distance between the prostate capsule and the nerves are just 1 or 2 millimeters. So with the use of robo, we can do this precise dissection. If we preserve the nerves, then the chance of losing erections would be very less. Whether they qualify for this or not, we need to discuss with the patients. But it is possible to preserve their sexual function, and by doing precise dissection, we can even give them continence or bladder control soon after this surgery.
Okay. It is again a case-to-case basis, but
Yes.
most cases you will be able to help them.
Yes, it also depends on the stage of the disease. If already nerves are involved, then we don't preserve the nerves. In that case, the chance of losing erections will always be there.
Yes.
So this is always, we always have a dialogue with the patient. We understand the requirements. We understand the disease process. Accordingly, we plan the surgery.
Makes sense. Great. Let's move to the last myth of the day, which is the most frightening one as well. That if somebody is diagnosed with, prostate cancer, then it's like a death sentence. Is it so? Is it a myth or is it a fact?
It's a myth. Fortunately, most of the urological cancers, or for that matter, any cancers, if you detect in an early stage, cure is possible. That is more so with prostate cancer. As I told you, if it is in stage 1 and stage 2, almost close to 100% we can cure. Even stage 4 disease, we have seen many patients surviving for 6, 7, 8 years. But during the 6, 7, 8 years of their survival, they'll be receiving hormone therapy, chemotherapy, so many modalities of treatment. It comes at a cost. Cost of these therapies are very expensive, and they suffer from side effects of that. Okay, so that is the reason why I told you it is always better to detect in a first stage, a second stage, cure it. Don't allow the disease to, present at a stage 4 disease where cure is not possible. You end up spending a lot of money. At the end of say 6 or 7 years, they die after spending so much of money. So that's why I urge everyone who is seeing this video, please educate your relatives, educate your family and friends to do PSA from the age of 50 years for all men yearly once. And if you have any family history of prostate cancer, breast cancer, colon cancer, and ovarian cancer from the age of 40 years, yearly once. This is our social responsibility, and we can detect early and we can cure. Cure is possible.
In our previous conversation, you mentioned about robotic surgery. Of course, India is not very new to robotic surgery. There's been a lot of tech that has been imported from Western countries, and we are also medically as advanced, as compared to other countries. So, just for the audience understanding and knowing how this thing works, so can you give us a walkthrough of how does the robotic surgery actually works, and what is the difference between a previously how we used to do and now what is?
Yes, it's a very important and interesting question. Uh, in open surgery, a big incision will be there where we put our hands inside and do surgery. We have vision from only one angle, unlike in robotic surgery. And we use our hands. Sometimes we cannot access a particular part of the organ. When it comes to prostate cancer is situated deep inside the pelvis, bony pelvis. where it's very difficult to, put our hand to do the surgery because of closed space. That's where robotic surgery plays a major role. The principles of robotic surgery is similar to laparoscopy, wherein the small instruments or keyhole instruments, okay, very slender instruments goes through keyhole of the abdomen, and these instruments are special. Where once instruments goes in laparoscopy, you have very limited degrees of freedom. Say 4 degrees of freedom means the instrument can go inside, outside. It can rotate right side and left side, or you can rotate like this. This is called 4 degrees of freedom. Whereas the beauty of robotic surgery is the end of the instrument can rotate like endorist. It can rotate in any direction. So when we go inside the pelvis to do the surgery, we can rotate these instruments in whichever direction we want. We can cut it precisely, we can suture it precisely. And this comes at almost 10 times magnification, which is present with the robotic system. This is 10x optical zoom and 4x digital zoom. That means 40 times magnified view we get it. We sit on a console not near the patient, away from the patient, where our console is connected to the patient cart. We sit comfortably and we move the actuators, or in a layman's term, it's called joysticks. Right. By doing this precisely, the same movements will be duplicated within the patient's body in real time. So I'm sitting comfortably, my ergonomics are perfect. I have 3D vision with 10 to 40 times magnification, and my instruments can rotate in any direction. It's called 7 degrees of freedom. Because of these technological advancements, we can do precise surgery, we can give best outcomes, blood loss is less. Because it's a keyhole surgery, the patient recovery is fast, wound complications are less, they can go back to their work early. So these are the big advantages of robotic surgery compared to laparoscopic surgery or even open surgery. So this has become standard of care for radical prostatectomy surgery, or when you want to remove the prostate for cancer in the prostate, robotic surgery has become standard of care globally, not just in India.
Great. So now that we have such a advanced technology, and like you mentioned, all those zooms and everything. So let's say somebody get diagnosed with a stage 1 cancer. Now, how long does it take for them to get cured in a usual case?
So if you do the surgery, if it is confined within the prostate, it you can say it's cured. Of course, how do we say whether they are cured or not? We always follow up with PSA. If the PSA remains very low, that means that they are cured. But follow-up, long-term follow-up is very, very important. Okay. When it comes to first stage, second stage, it's fine. If it is in stage 3 disease,
let's say if it's first stage, how many days will it take for them? Let's say they come to a hospital.
It is not cure. We don't talk about cure initially. They go home second day. If you operate today, tomorrow, day after tomorrow, they go home with the urinary catheter. We remove the urinary catheter in 8 to 10 days time. By then, at least 40% of our patients will not have any leak. Remaining people can have urinary leak, and gradually over a period of 2 to 4 months, they become all right. This is according to global standards I'm talking.
If they're in stage 2, how long does it take for them to get cured?
No, it is
cured. Okay, at least to take care of it.
It does not depend on the whether it's stage 1 or stage 2. As long as theoretically cancer cells are present within the prostate, if it confined to the capsule of the prostate, if you remove that, it amounts to cure. Okay. Sometimes we assume that it is in stage 2, but some cancer cells must have escaped the prostate and it may be there outside the prostate. There the disease can come back. So monitoring PSA at regular intervals, almost we say lifelong follow-up is required. Okay. Because even if the disease comes back after surgery in stage 3, it is possible to give radiotherapy and still possible to cure. So we should not miss that opportunity. That's why follow-up is very important.
Okay. So you mentioned, like in every conversation of ours, one common thing was always about the stages of the cancer. Yes. And I think it is common for any cancer. We always keep hearing stage 1, stage 2, stage 3, and they're like, okay, they're in the last stage of the cancer and all of that. So how does these stages are defined? Like what is the parameter where you say this is stage 1, stage 2?
It depends on organs.
Okay.
When it comes to prostate cancer, stage 1 means it is detected based on the PSA.
Okay.
Stage 2 is it is present in one half of the gland. Again, stage 2 is divided into A, B, C. One half of the gland, half of one part of the gland is 2A. 2B is one half of the gland. If both sides of the gland, right side and left side, is involved, it is called 2C disease. If it has gone outside the prostate capsule into the seminal vesicle or neurovascular bundle or to the lymph nodes, it's called stage 3. Stage 4 means it has gone outside the pelvis into bones, lymph nodes beyond the pelvis, lungs, brain, or any other vital organs. It is called stage 4. This is specifically for prostate cancer. Similarly, for different kidney tumor, like kidney tumor, bladder cancer, it is slightly different. But
Okay.
general principles are almost same.
What are the urological guidelines that you have where you mentioned a lot of things, right? What do you have any specific set of rules and guidelines that you follow
Yes.
in the industry?
Whatever I said just before, this is all recommended by Indian Urological Society guidelines, American Urology Society guidelines, and European Urology Association guidelines. We follow the same guidelines I told you. So I request you to do the same and save your family or friends or someone who develops prostate cancer, save their life.
Doctor, it has been an incredibly enlightening session for us today to understand and to even get a sense of what is happening in and around prostate cancer. So, do you want to leave us with a final message to all the audience today?
Thank you. Uh, Please do master health checkup and screening, not just PSA. PSA is recommended for all men. I urge every individual from the age of 35 to 40 years to go for master health checkup, do your screening, and save your life. Thank you.
Just to recap, here are the 5 myths that we tackled today. Prostate cancer is not just for elderly men. Having no symptoms does not mean you're safe. A high PSA result does not always necessarily means that you have cancer. Treatment does not always mean that you are losing your quality of life. If you remember one thing, then remember this. Early detection saves lives and knowledge replaces fear. On behalf of Delarc Pharmaceuticals, we extend a huge thanks to Dr. Raghunath for sharing his insights and taking us from fear to facts. And to you, our listeners, let's turn this awareness into action. Talk to your doctor and share this episode with someone that you really care about. Together, we can end the stigma and make men's health a priority. Thank you.